Picture this. You just walked out of the hospital after finishing an exhausting but incredibly lucrative travel nurse contract. You decide, you know what, I'm going to treat myself. A full 2-week vacation before the next contract starts. Everything is absolutely perfect. Until you slip and break your ankle while hiking. Now you might be thinking, ouch, but hey, it's fine. I'm a nurse, I know the drill, and obviously I have health insurance, right? Well, hold on a second. Do you actually have coverage? Because here is the harsh reality that might actually hurt way more than that broken ankle. If there is a gap in your coverage between contracts, even for just a single day, and you didn't set up a replacement, that emergency room bill could easily skyrocket to $30,000. I mean, we are talking about wiping out weeks and weeks of your hard-earned 12-hour shifts in an instant. Welcome back to Nurse Money, everyone. Today, we're diving into a crucial explainer on a fact that every single one of us needs to wrap our heads around. Travel nurse health insurance is not automatic. As a fellow nurse, I want to emphasize that unlike a standard staff position, our travel lifestyle comes with incredible freedom. But it also means we have to actively step up and protect our hard-earned money from completely preventable financial disasters like this. Let's dive right into Section 1, the unique risks, and exactly why travel nurses are so vulnerable to these insurance gaps. There are 3 major traps we tend to fall into. First up, gaps between contracts. Even if you're just taking a week off, your agency-provided insurance might literally vanish the second your final shift ends. Second, your coverage is usually tied to the agency itself, not to you. So if you switch agencies to chase a better pay package, you might hit a waiting period before your new insurance kicks in. And third, state-specific networks. The health plan that covers everything seamlessly in Texas might have absolutely zero in-network hospitals in California. This is exactly how nurses end up paying out of pocket. Moving right along to Section 2, let's break down your 4 specific health insurance options to protect your income. Option 1 is agency-provided insurance. The biggest pro here is obviously convenience, right? Usually, your coverage kicks in right on day 1 of your assignment, making life easy. But the major con you have to watch out for is the hidden end dates. Agencies almost never cover you during the gaps when you're waiting to start your next contract. So it's super convenient, but it comes with some incredibly strict timelines that can bite you. Next up is Option 2, ACA Marketplace Plans, which you probably know as healthcare.gov. This option is fantastic because it gives you total control. Your coverage doesn't suddenly drop just because you switch agencies. Plus, since travel nurse income can fluctuate so much throughout the year, you might actually qualify for government subsidies. The downside, though, is that if you don't qualify for those subsidies, you are on the hook for paying the full monthly premium all by yourself. Now, if you can swing it, Option 3 is often the absolute holy grail, jumping on a spouse or partner's plan. If your partner has a stable job with great employer benefits, I strongly advise looking into this. It is almost always the most cost-effective way to completely bypass the entire headache of travel contract gaps. You just get to travel and work with total peace of mind. But what if Option 3 isn't on the table for you? That brings us to Option 4, short-term gap insurance. These plans are the perfect affordable bridge for those 2 to 4 week breaks between assignments. Yes, the coverage is a lot more limited than a standard medical plan, but it is specifically designed to stop you from going bankrupt over that $30,000 ER bill we talked about earlier. It's an emergency parachute. When we lay these 4 choices out side by side, comparing the actual costs, the level of convenience, and how well they protect you during your time off, it becomes so much easier to visualize exactly which strategy fits your upcoming travel lifestyle. There is no one-size-fits-all here. It's about what works for your current financial situation. All right, let's move to Section 3, 5 essential questions you absolutely must ask your recruiter before you sign on the dotted line. Question number 1, what day does my health insurance actually start? This isn't a trick question, it's financial life or death. You need to know if coverage starts on day 1 of orientation, when you're just sitting in a classroom listening to HR, or day 1 of actually working on the floor, because sometimes those 2 dates are a full week apart. Question 2, what day does my coverage end?
Do not just assume it lasts until the end of the month. You have to ask if the insurance drops at midnight on your exact last day of the contract, or if the agency provides a grace period so you can actually travel back home safely while covered.
Question 3. Is there a waiting period before coverage becomes active? You really have to watch out for this one, especially when switching to a brand new agency. Hidden waiting periods can leave you completely exposed, with zero coverage during your very first weeks living in a totally unfamiliar city. Question 4. Can I extend coverage between contracts, and at what cost? Be direct here. Ask them explicitly if you have the option to pay out of pocket to extend your agency coverage during those crucial weeks off while you're transitioning to your next assignment. Question 5. What does the plan actually cover? Don't just tick the box that says insured and move on. You need to check the out-of-pocket maximums. Find out if it's a high-deductible plan, and most importantly, verify that the healthcare network actually exists and functions in the destination state you're traveling to. Now, I need to stress this next point as emphatically as I possibly can. Get every single one of these answers in writing. Seriously. Verbal promises from a recruiter, no matter how friendly they are, mean absolutely nothing when you are sitting in a hospital waiting room. If you don't have a documented benefits summary, you are simply not protected. Let's pull this all together in Section 4. Here is your concrete action plan so you never get caught without coverage. Here is what you need to do today. Step 1, like we just said, get those recruiter answers documented in writing. Step 2, mark the true insurance start and end dates on your calendar, not just the contract dates, the actual insurance dates. And step 3, if you know a gap is coming up between assignments, start researching your short-term coverage options at least 2 weeks early. Don't wait until your insurance is already expired to figure it out. To finish out the action plan, step 4 is to save digital copies of your policy cards right to your phone or your Google Drive. You want to have them ready to go the second you need them, no matter where you are. And step 5, build a specific health buffer fund of about $1,000 to $2,000. Keep this stashed away purely for unexpected medical transitions or premium payments between contracts. Travel nursing offers us incredible freedom and income, but only if we take the steps to protect ourselves. An insurance gap is literally the most easily preventable financial disaster out there. Yet nurses get caught in it all the time. If you want to stay informed and keep protecting your income, make sure to subscribe to Nurse Money for new explainers every Tuesday and Friday. Before we wrap up today, let's help each other out. Go ahead and drop your own insurance gap stories in the comments below. Your real-world experience might be exactly what warns a fellow nurse and saves them from taking a massive financial hit. Also, coming up this Tuesday, we are doing a real nurse finance Q&A based on the sources we've been analyzing today. If you have any specific money questions or you're stuck on a confusing contract detail, drop those in the comments right now so we can cover them in the next explainer. I'm going to leave you with one final provocative thought to sleep on tonight. Have you verified the exact end date of your current coverage? Seriously, I challenge you to go pull up your contract tonight and double check. Thank you so much for joining me to protect your financial future. Stay safe out there, and I will see you in the next explainer.